Hey guys, Dr. Lee here. So if you're watching this video right now, one of two things are true. Either number one, you're a wellness patient of ours, so you've been under care for years, maintaining your spine in great health. Or number two, you're a newer patient who has just finished the corrective care process with us and is going over recommendations so that we can work to keep your spine healthy moving forward. One of the things that we stress in our office is the importance of keeping a healthy spine and nervous system for a lifetime. So as we go over your x-rays, we're looking to see what changes, what improvements we've made, and what we need to do in the future to keep your body functioning at its best. So as we go over your x-rays, the things that we want to understand are, is your spine healthier? Is it moving into a better alignment? Is it staying stagnant? Or if you've had more traumas or injuries, is it getting worse over time? That's going to really help us determine a good course of action, from the frequency you need to be adjusted in the office to what home care exercises we would need you to do, and overall if there's anything we need to add to your protocol to make sure that we're supporting you to be at your best health. I think the reasons that a lot of us start getting adjusted in the first place are not necessarily for the reasons that we're going to continue getting adjusted to keep our spine healthy. In all honesty, most of us, and this is the same thing for me, first got adjusted because I had some type of pain or some type of problem. Pain is a huge driver of action. When we're in pain, we want to do something about it. We want to get out of pain. But that's not the reason that chiropractic is the most beneficial for the longevity. So once we get out of pain, what really starts to happen is we start to realize, as we're getting adjusted, that we're performing better. So our body's starting to move better. We're having less injuries. We're really starting to, come into our own when it comes to feeling great on a daily basis. That's really one of the things that I love about chiropractic care. On top of that, once we start realizing that we're feeling better, moving better, our life's better overall, we're getting better rest, then we start thinking logically, well, listen, if this is working well for me, maybe I should do this as a preventative means so that I don't have those problems come back in the first place. And that's really a great way to start thinking. If I can prevent future issues from happening, then my life's going to be way better overall. For all of us, time and stress are never going away. So preventing problems and staying ahead of our health is extremely important. Once we start realizing that chiropractic can help us prevent future issues, that's really where we can start thinking about using this as a strategy to help our bodies long term. And there are a ton of research studies that actually prove that chiropractic care on a regular basis helps keep your body functioning well. In fact, a long-term study, a 7-year study, was done and looked at patients doing chiropractic care as a means of prevention, meaning they are using it to enhance their quality of life. And what they found was that people who were getting adjusted regularly, on average, took 85% less medication. They were hospitalized for emergencies 60% less often, and that contributed to a total health cost savings of 69% in healthcare costs. So they were getting care, they were preventing problems, they were feeling functioning, working better overall, and they were saving money out of pocket. And that's really the goal with prevention. We're all going to spend money somewhere. It's either on prevention or it's on disease management. And my encouragement for everyone, my family, you guys, anyone in our community, is to invest the time, invest the effort in staying healthy, because it's so much more affordable than dealing with the disease long term. The really cool things on top of this when it comes to chiropractic care are longevity and increased healing. We know that the healthier that your spine is, the better your nervous system functions. And there are so many research studies that have now been showing that having a healthier spine leads to a longer, healthier life. In fact, having an unhealthy spine over the age of 65 is an increased risk factor for mortality that's equivalent with smoking. So yes, having a bad spine and smoking are on par with each other when it comes to taking years off of your life. The biggest thing to understand overall when it comes to getting chiropractic care long-term is that chiropractic care influences your nervous system. So at the end of the day, as we're adjusting and taking care of your spine and keeping you and your family healthy, we want to optimize something very important in your body, that is healing. Chiropractic influences your nervous system to help your body heal and function better. So it's not just about controlling pain or helping you feel great. It's about helping your body heal well. There are countless research studies now that are showing that getting chiropractic care helps with gut health, helps with cardiovascular health, helps with lung health, helps with wound healing. And so as a long-term goal, these are the things that we want to help you guys with in the office. So today, as we update and go through your x-rays, we'll also be giving you an updated frequency. For most of our patients, we find that the sweet spot for getting adjusted is between once a week and every other week. What research and science shows is that after 10 to 14 days of stress on your spine, it being in a bad alignment, it starts to degenerate or break down. So very rarely do we recommend frequencies that are more infrequent than every other week. for the fact that we don't want to be taking care of you on a long-term basis and be watching your spine slip backwards when it comes to your health overall. And after doing this now for 10 years and taking x-rays on tens of thousands of patients, I've noticed that the better that we maintain our spine from a frequency standpoint, the less it forms arthritis, the less it breaks down. So today we'll be going over those updated frequencies with you and showing you a protocol that helps you afford wellness care for a lifetime. The last thing, if you're getting healthy and you're doing well inside of our office, I'm going to encourage you on a couple things. Number one, it's engage in the other essentials. Whether you have questions on nutrition or metabolism or toxicity or how to exercise properly or the mindset component of our care, we want to help encourage you to be healthy from the inside out. And the last thing is, if you're getting great results in our office, the best compliment that you can give us is trusting us with taking care of your family and friends in this community. You know, there was a massive hospital wing that was built as an addition onto Riverside Hospital a few years ago. I drive by it all the time. And one of the things that always comes into my mind is that, you know, everyone in that giant hospital system, nobody ended up wanting to be there. So when it comes down to health long-term, it's about prevention. It's about taking control of our health and working to keep ourselves healthy on a daily basis. We are no more than the sum of the actions we do on a daily basis that either benefit our health or hurt our health. And so that's our mission in this community, is to help educate as many people on where health comes from and how to be truly healthy from the inside out. So we enjoy you guys being on this mission with us, and we appreciate your efforts to help us spread this to the community as well.